Hello there and welcome to the channel. I'm Stephen Bunting and I'm a physiotherapist working in the northwest of England. This video tackles the single most common cause of elbow pain in adults, tennis elbow, and also the second most common one, golfer's elbow. As with my other videos, I'll be addressing these conditions by answering the three most common questions that people ask after they've been diagnosed. Number 1, what is the problem? Number 2, why have I got it? And number 3, what can I do about it? Okay, so let's get cracking with question 1. What is tennis elbow and indeed golfer's elbow? Well, the first thing to say is that you certainly don't have to be a tennis player or a golfer to have these conditions. In fact, it's much more common in people who've never even picked up a tennis racket or swung a 7-iron. The names were first used in the late 1800s when it was noticed that elbow pain was commonly seen in people involved in recreational tennis and golf at around that time, mainly because the early rackets and clubs they were using were heavy and poorly designed compared to today's modern equipment. That's not to say that golfers and tennis players of today don't get these conditions. They certainly can do, but as we will learn, there's more to them than just simple sports injuries. The source of pain in both tennis and golfer's elbow is a tendon. Tendons can come in lots of different shapes and sizes, and these ones are short, flat strips of connective tissue where the muscles of the forearm converge together as they attach onto the elbow. In tennis elbow, it's the forearm muscles that cause wrist extension, which come together to form a shared tendon called the common extensor origin. This attaches to the outside of the elbow just here, at a bony area called the lateral epicondyle. And if you make a strong fist, you can feel the tendon tightening right at this point. And this is usually the area of maximum tenderness if you have tennis elbow. And you'll know this because you will no doubt bang the area numerous times a day, resulting in an outburst of unsavoury language. A few other simple tests are pain on gripping and pain on resisted wrist extension. You can do this by reaching out in front of you with palm downwards and then trying to keep your wrist straight while pushing it down with your other hand. Sometimes doing the same movement but with just your middle finger might be particularly painful, as it concentrates the force through one of the forearm muscles called the ECRB, which tends to form the main part of the tendon that most commonly affected. Golfer's elbow is similar, but occurs on the inside of the elbow at a bony point called the medial epicondyle, just here. This is the point where the forearm muscles that cause wrist flexion converge on a shared tendon called the common flexor origin, and this is the area of maximum tenderness in golfer's elbow. And again, if you make a strong fist, you can feel the tendon tighten up here. So to summarise, the symptoms of tennis elbow are pain and tenderness over that prominent bony area on the outside of the elbow, and the symptoms of golfer's elbow are similar, but the pain and tenderness are over the bony region on the inside of the elbow. In both conditions, the pain can spread down into the forearm, and gripping activities will tend to aggravate symptoms. Usually, you will still have a full range of elbow movement, although there might be some pain at end range. If you have a marked loss of elbow movement due to stiffness, then do get checked out by a clinician, as there may be something else going on that's interfering with the elbow joint. So those are the symptoms of tennis and golfer's elbow. Now let's go on to question 2. Why have I got it? Both tennis and golfer's elbow are overuse conditions. In tennis elbow, it's an overuse of wrist extension, which overloads the common extensor origin tendon and causes disruption of the tendon fibres. This is the movement associated with the backhand stroke in tennis, which is where it gets its name, but in modern life it's more commonly associated with work-related repetitive wrist extension activities, such as computer or mouse use, and particularly with gripping activities. You have to extend your wrist in order to achieve full power. So any repetitive gripping activity can cause tennis elbow, and we see it a lot in factory workers, plumbers, carpenters, butchers, mechanics, hairdressers, florists, machine operators and people who work with vibrating tools. Of course, It's also seen in racket sports, but also in rowing, throwing sports and in musicians, particularly pianists. It also doesn't have to be a low-level repetitive overuse. You can also get it with a single bout of heavy gripping activity, which I can attest to personally, as I had tennis elbow myself a few years ago after carrying a really heavy bag of fossils for my geologist sister for just 20 minutes. Golfer's elbow is similar, but involves repetitive wrist flexion as seen in the right wrist of a right-handed golfer during the golf swing. As with tennis elbow, it's also common in throwing and racket sports, including tennis funnily enough, but it's the forehand action that stresses the common flexor tendon rather than the backhand as we see in tennis elbow. In the workplace, it's seen in similar occupations to tennis elbow, but if I was to invent a job that would be highly likely to cause golfer's elbow, I would have someone repetitively turning a heavy revolving door or spinning a stiff horizontal wheel. It's that open-handed slapping type movement that stresses the tendon and causes the condition. So to summarise, both tennis and golfer's elbow are caused by overuse of the tendons involved in wrist movement, beyond a level that they can cope with, which then causes degenerative changes in the collagen fibres that make up the tendon. It can be a single heavy use activity that you've done, like in my case of carrying the really heavy bag, but more commonly it's a low-level repetitive overuse, sometimes over many months until the tendon starts becoming painful. It's also worth noting that you can have both tennis and golfer's elbow at the same time and in the same elbow. Both conditions affect men and women equally, with the most common age range between 35 and 55 years. Tennis elbow is by far the more common condition though, being about 7 times as common as golfer's elbow. Okay, so that's what causes them. So now on to question 3. What can I do about it? Well, this is a good news and bad news situation. The good news is that 80 to 90% of people with tennis or golfer's elbow will get better over time, often without any treatment at all. The bad news is that it's a slow recovery. Symptoms can take an average of 1 to 2 years to settle down, and even longer in those cases where the person doesn't or can't rest from the aggravating activity that's causing it. So, if you're happy to ride the tide and wait for a natural recovery, then you might not need any treatment at all. You just need to be patient. However, if you're going to do this and let it get better by itself, then it is important that you first identify the activity that caused the condition and then stop doing it, or at least significantly reduce it. If it's a single event, like in my case of carrying the heavy bag for my sister, then it's fairly easy to just not do that thing again. But for those of you who have a job that is the cause, then it might prove to be more difficult. But you must reduce the stress through the tendon, or you're going to prolong your recovery, or it might worsen until you're forced to rest it. Your work situation is going to be unique to you, so if you can't work out a solution yourself, then talk to your employer or get an occupational assessment. It may be something as simple as using an ergonomic mouse and keyboard to neutralise your wrist position, or using a tool designed to reduce grip pressure. If it's a sports related problem, then it might be best if you do see a physio, a sports therapist or a coach familiar with managing these conditions. Things like technique, practice routine, racket string tension, grip width can all contribute to this problem. So unless it's something really obvious, get checked out in order to address your specific issues. One thing that can usually help with the pain is a supportive wrist brace. Wearing a tennis or golfer's elbow clasp, sometimes called an epicondylar clasp, can undoubtedly help with reducing pain. You'll find that you can grip stronger and with less pain when wearing one. It won't cure the problem or get it better any quicker, but if you wear it while doing your sports activity or while at work, then it can certainly help. It works by adjusting the angle of pull when the forearm muscles act on the tendon. As a quick experiment to see if it will work for you, make a fist and then grip tightly until the pain starts. Then do that again, but this time with your other hand squeezing around the thickest part of your other arm. Then make your fist again. In most cases, you should feel that you can grip harder and with less pain while squeezing your forearm. And that's how the clasp works. You wrap it around the thickest part of your upper forearm, but not over the elbow joint itself, or you won't be able to bend it. If it has a wider part at one end, then position it so that part is over the outside of your upper forearm if you have tennis elbow, or on the inside of your upper forearm if you have golfer's elbow. Some people find the sleeve type clasps work better for them, but it really is a case of trying and seeing. They are generally inexpensive, and I'll put a link in the description to some suitable clasps that I can recommend. Taping works in a similar way, but it can be messy, difficult to apply yourself, and you need to reapply it regularly. As such, I don't tend to advise tape. The clasps or sleeves are a better option in my opinion. Okay, so that might be enough for you, and indeed that's what I did with my tennis elbow. I just avoided painful movements, wore the clasp on bad days, but otherwise continued to use my arm normally, and it slowly got better over the 18 months. The rest of this video will go on to explore the treatment options. So if you're happy with what you know now, your symptoms are manageable, and you just want to let nature take its course, then you can stop watching. For the rest of you, let's go on and take an honest look at the evidence for tennis and golfer's elbow treatment. Now unfortunately, when you look at all the research, there really is no single reliable treatment for tennis or golfer's elbow. There are things that you can try that might work in your case, or they might not. You can get a feel of this uncertainty by simply Googling tennis elbow or golfer's elbow treatment and seeing the myriad of different suggestions that come up. And this should ring alarm bells that a simple cure just doesn't exist. So ignore anything you read about miraculous treatments claiming to cure the problem in a few days or weeks. If it gets better that quickly, it probably wasn't tennis or golfer's elbow in the first place. It was probably just a simple muscle or ligament sprain. The treatments we will discuss will depend on the severity of your symptoms. If your pain is severe, then you're certainly going to need to rest your elbow. The use of heat or ice can help. Use a hot pack or a cold pack for 20 minutes at a time. Try both and see what works best for you. You might also want to consider using an anti-inflammatory gel or a short course of tablets, but do talk to a pharmacist first, as not everyone can take anti-inflammatories. The pain should then settle down over about 3 to 6 weeks to a more manageable level. At that point, you can either go with the flow and patiently wait for natural recovery, as we've already discussed, or you could try to speed things up by using some of the treatments we will now discuss. First up is exercises, and of all the treatments available, exercises have the best overall evidence base, but they do require a commitment in time and effort over many months. And in my experience, other than professional and keen amateur sports people, not many folk, myself included, have the patience and strong-mindedness to do them regularly in the quantities needed. I've done a separate video to demonstrate a suitable program, which I'll put links to up here, or you can see the video description below. The main rule with exercises is that they should be pain-free. This is why they aren't a good idea if you have more severe pain, as you won't be able to do them without aggravating the condition. So the pain must have settled down to a mild or manageable level before you do them. Exercises work by slowly increasing the strength and resilience of the tendon until it can cope better with the workload you're asking it to do. Changing a degenerative gristly tendon into a healthy, lean tendon takes time, and we are talking about months rather than weeks. Those collagen fibres will respond to exercise and load, but it's a slow process, and that's why patience and commitment are required. As far as the other self-help treatments go, that's pretty much about it. Everything else you see on the internet is not supported by the research, and that includes things like therapeutic ultrasound or indeed any other type of electrotherapy. Also, friction massage or any other hands-on therapy. A few days of pain relief is about all you're likely to get with these treatments, and that's not good value for something that could take 18 months to resolve. That's not to say they might not work for you, but it's just that the research doesn't support their use. So generally, I would advise saving your money. If you think about it though, assuming your tennis or golfer's elbow is like mine and is going to take about 18 months to settle, and you decide to splash out and work your way through all the self-treatment suggested on the internet, then whichever of these treatments you are using at the 18-month point will be what you perceive as being the cure. And you then might tell other people that worked for you. And that's how a lot of these so-called treatments gain traction, by word of mouth and not evidence-based research. Food for thought. For the other treatments we will now discuss, you're going to need to see a clinician. And the first thing you might have heard of is a cortisone injection. These used to be a commonly done procedure, as they can undoubtedly provide some pain relief, but the effect usually wears off within a few weeks, and then the patient comes back wanting another one, and then another one, and then another one. And the most current research has found that patients who have repeated cortisone injections can develop a degree of structural weakness within the tendon, which actually prolongs the condition and makes it more likely that they're going to have another episode in the future. So basically, in the long term, cortisone can cause exactly the opposite effect of what you want to achieve as a clinician. The cortisone basically reduces the resilience of the tendon and makes it more vulnerable to injury in the future. As a result, I rarely offer cortisone injections now, and if I do, it's only ever in very specific cases and only ever as a one-off. The other treatments I'm going to talk about all work on the premise that tennis and golfer's elbow can be considered a type of injury where the tendon healing process becomes stuck, and by trying to re-injure the affected tendon in a controlled way, we can try and kick-start this healing process and stimulate recovery of those degenerative tendon fibres. These treatments are used on many different tendon and other chronic soft tissue problems such as Achilles tendinitis, plantar fasciitis and lateral hip pain, as well as tennis and golfer's elbow. The first of these provocative treatments is extracorporeal shockwave therapy. This is a treatment which uses high pressure sound waves to disrupt the collagen fibres in a way that stimulates the healing response. It's a treatment that usually lasts around 10 minutes and is typically delivered once a week over a 3-week period. It'll cause a temporary increase in pain, as it is essentially re-injuring the tendon in a controlled way in order to prod it into kick-starting the healing process. Patients are then reviewed about 6 weeks later, when the treatment can be repeated if needed. Another way of trying to stimulate this healing response is to cause some bleeding around the tendon. We know that blood contains various growth and repair factors that initiate healing when you have an injury. By hijacking this system, we can try and encourage the tendon to repair itself. The easiest way of doing this is by using a needle to cause some disruption and local bleeding. Acupuncturists can do this, but it can be an uncomfortable process. A better way is by using some local anaesthetic and then inserting a normal injection needle under ultrasound image guidance directly into the painful part of the tendon. The needle tip is then used like a mini scalpel in order to injure the collagen fibres. Because you're trying to cause local inflammation, you should not use anti-inflammatory medication like ibuprofen for 2 weeks before or after the procedure. This is called dry needling or needle fenestration, and it's considered to be a healthier alternative to a cortisone injection. The latest treatment technique takes this process a step further. A process called PRP, or platelet-rich plasma, involves taking some blood from the patient, spinning it in a centrifuge, and then separating out the platelets which contain all those growth and repair factors, and then injecting these platelets back into the tendon. PRP is becoming more widely available, but you might struggle to find it being offered on the NHS at the moment because it's still an active area of current research, and the jury is still out regarding its overall effectiveness. And finally, for the most severe cases that have resisted treatment and the passage of a few years, surgery might become an option. Less than 5% of all cases get to the stage of surgery, but if you've had fairly intrusive symptoms for a few years, then it might be worth seeing an elbow surgeon. And that's it. I do hope that the video has provided some useful information. Don't forget to check out the exercise video as well. Thanks very much for watching, and bye for now.